ABR Facts 2012 Extended Progress Overview of the 3-year-old GMFCS Level 4 Quadriplegic Girl with Cerebral Palsy Part 3 Video 2. 3 main anchors of development for weak quadriplegic child with cerebral palsy: chest, shoulder girdle, and neck. The video 2 covers the second main anchor of development, shoulder girdle, and particularly the deep fascia connections within it. Well, this is the second anchor in our review of the key important elements for the weak quadriplegic child, and this is about the shoulder girdle. So again, let's get a quick review of the achievements of this particular girl. First of all, let's look at the situation after. You can see I'm bringing her on the elbows, then from the elbows position she is able to transfer herself. When I'm supporting her by the shoulders, she is using her hands, playing around as I'm moving her by the body, then planting her on the elbows, and from there on she is able to shift the weight from one arm to another. Of course, there is room for better strength, but this is a basic competence coming with the strength of the arm and clear usage of the arms for their weight transfer. And let's get back to what we have seen before. Any attempt to get into their elbow-based positioning leads to the drop. The attempts to place her on the arms don't really work. She is completely collapsed there, and this is the essence of helplessness. So what we want to understand, again with the improvement, everything is quite straightforward. She can now use her arms, and you can see that the appearance of her back looks more and more regular, not ringing any bells. So let's have a look at the situation before, because that's going to be more informative for you and going to help you to evaluate your own kids. Well, I must say that this view on the right, on the left, is not for the fainted-hearted. What you're seeing here, this is the picture taken at exactly the same time when we were testing her positioning on the elbows. And I hope that now you would be able to realize why she is so collapsed and incapacitated in this position. Because you can see that her arm is completely detached. Her shoulder blade is so poorly attached to the rest of the body that of course any attempt to do any weight transfer on it ends up with a complete disaster, and simply it can't work. It's just disconnected. So this is the element of the disconnection of the shoulder blade. But at the same time we can see the second trouble as well. You can observe here on this particular sequence how weak is the shoulder joint connection. So in fact she is experiencing double trouble. Her shoulder joint is extremely weak, and her shoulder blade is completely disconnected. So you can see the differences between the two. So now this is a lot more stable and a lot doesn't slide on the side, whilst before what we've seen, the shoulder blade was completely off and effectively getting close to the chin when the arm was moved, and when the weight was transferred, well, the arm was effectively disconnected. So this is a double trouble. Let's take a few seconds to summarize the key notions about the shoulder girdle as one of the 3 main anchors of development for a weak quadriplegic child. The key ideas, the key factors that you have to look at are the disconnection of the shoulder blade and the weakness of the shoulder joint capsule. These are the connections which are defined by the strength of the deep fascia which attaches it to the deeper layers, not by the muscles that come across or bridge over it. And this is extremely important to understand, because otherwise if you start thinking in terms of muscles and try to release the muscles or do some fitness actions towards the muscles, well, you are missing the boat. You are actually not addressing the cause but just trying to fight with the effects. And I hope that you are having these aha moments. realizing that, well, this is essential, this is fundamental, because the most important aspect here is that these disconnections are not muscle based. These are the elements where the disconnection stems from the weakness of the deep fascia attachments to the underlying layers. It's not the muscles which are actually at fault or which are creating these troubles. Muscles are victims in this situation. And therefore, if you were trying to teach a child who experiences this kind of troubles, but when I talk about this kind of troubles, I don't talk about this extreme extent to begin with, right? Even if your child has half of this trouble, still any attempts to use the arms are going to be extremely difficult. And I think that this set of pictures on the left in 2009 illustrates it incredibly well. Because of these double disconnections, the weakness at the fascial attachments of the shoulder blade and the shoulder joint capsule itself, what happens? Well, these arms are not really usable for the support, and that's why you're seeing these weird positionings. And what happens when I'm trying to just lift her by the arms? What is happening? You can see that the shoulder blades effectively get disconnected from the rest of her body. How can she possibly use these arms? And again, my message is very straightforward. Think about it. Think about understanding this key element. And when you ask yourself a question next time, why my child is having trouble with using the arms, whether it's a fine motor skills, whether it's the weight transfer, whether it's anything, well, probably there is a missing component there. And again, if your child is quadriplegic, it's for sure that there is this missing underlying component that you haven't addressed so far. The disconnection and the fascial weakness at the level of the shoulder blades, attachments, and the shoulder joint capsule. So this is the key lesson. Once again, I want to highlight that any quadriplegic child is challenged by these two fundamental troubles: the disconnection of the shoulder blade and the weakness of the shoulder joint capsule. In approximately 70 to 80% of the quadriplegic cases, these weaknesses are easily observable. You do not need to be an expert with 15 years of medical education to notice them. And this is the key message. These challenges are so obvious that as a parent, if you look at these key fundamentals, you're going to see them. And again, I want you to make the connections and understand how you can contribute towards improving your child's condition by addressing these particular anchors. You have to look for those fundamentals when you want to understand what's happening to your child, and it is observable. In 70 to 80% of the cases, as I already said, it's observable quite readily and quite easily. So you don't have the excuse of, oh, I'm just a parent, I'm going to trust the professionals. It's so straightforward, so obvious, you can observe it yourself. And once you observe it, you should realize, oh, this is a major reserve. This is how I can improve the condition of my child. And the entire set of examples here is designed to help you to understand that it is possible to improve the situation, that it is possible to get from this situation of the disconnected and unusable arms, which we observed before, to the situation where the arm actually helps in the support and could be used. So this is a straightforward message, and I hope that from this presentation you can take this lesson in a very straightforward fashion. Disconnection of the shoulder blade and weakness of the shoulder joint capsules, these are the key elements that you have to look in your own child if you want to improve any sort of the arm usage, from fine motor skills to the weight bearing to any interaction with the arms. Thank you very much for completing this video. I hope it has been helpful. It helped you to understand your child's needs better. And I'd like to ask you for a favor. I hope that we can have a dialogue, because so-called social media, Facebook, YouTube, Twitter, and so on, provides all sorts of feedback tools. like and dislike buttons, you can leave comments, you can share videos with your friends. In other words, it allows us to have a real two-way interaction instead of me just being a talking head or a voice behind the slides and the photos and you being just a faceless click for me. Because I put a lot of time and effort into making these videos, hoping that as a parent of a child with cerebral palsy you can get both education and inspiration from them. So I'd really appreciate if you can spend a few seconds and express your opinion. What you've got out of it, positive or negative, helpful or not, worth sharing and so on. The key thing is to hear your voice and to interact. Thank you very much. I really appreciate your time and effort for doing this.